Hello, welcome to Nursing Question Club. This week's lesson is endocrine system. So let's start with a video about endocrine system.
There is no sound.
Hypothalamus. Growth hormone. The wires. These hormones help control heart rate.
Sorry.
Hormones are chemicals produced by various glands. Hormones act as messengers affecting the activity of another part of the body. Such messengers are normally transported through the bloodstream. The pituitary is a pea-sized gland that controls the function of most other glands and secretes a variety of hormones, such as growth hormone and thyroid-stimulating hormone. The pituitary itself is controlled by a small brain region called the hypothalamus. Growth hormone regulates bone and muscle growth and physical development. The thyroid is a gland in the neck. It secretes thyroid hormones, which control the speed of the body's chemical functions, or metabolism. Thyroid hormones affect many vital functions, such as heart rate. Another gland, the pancreas, helps control the levels of glucose in the blood by secreting insulin, which moves glucose out of the blood and into cells. Diabetes occurs when the body does not produce enough insulin to control blood sugar levels. There are two adrenal glands, one on top of each kidney. The adrenals secrete several hormones, such as epinephrine, aldosterone, and cortisol. These hormones help control heart rate and blood pressure, maintain fluid and mineral balance in the body, and respond to stress and infection. The testes and ovaries produce sex hormones and reproductive cells under the control of the pituitary. The testes produce testosterone and sperm. The ovaries produce estrogen and eggs.
The endocrine system is a series of glands that produce and secrete hormones that the body uses for wide range functions. This controls many different bodily functions. Hormones are produced by glands and sent into the bloodstream to the various tissues in the body. They send signals to those tissues to tell them what they are supposed to do. When the glands do not produce the right amount of hormones, the cells develop that can affect many aspects of life. Question 1. During a class of exercise for diabetic clients, a female client asked the nurse education how often to exercise. The nurse educator advises the clients to exercise how often to meet the goals of planned exercise. A, at least once a week. B, at least 3 times a week. C, at least 5 times a week. D, every day. Answer is B. Diabetic clients must exercise at least 3 times a week to meet the goals of planned exercise, lowering the blood glucose level, reducing or maintaining to proper weight, increasing the serum high-density lipoprotein level, increasing serum triglyceride levels, reducing blood pressure, and minimizing stress. Question 2. The nurse is aware that the following is the most common cause of hyperaldosteronism. A, excessive sodium intake. B, a pituitary adenoma. C, deficient potassium intake. D, an adrenal edema. Answer is D, an adrenal adenoma. An autonomous aldosterone-producing adenoma is the most common cause of hyperaldosteronism. Hyperplasia is the second most frequent cause. Aldosterone secretion is independent of sodium and potassium intake as well as of pituitary stimulation. Third question. Following an unilateral adrenalectomy, nurse Betty would assess for the hyperkalemia shown by which of the following? A, muscle weakness. B, tremors. C, diaphoresis. D, constipation. Answer is A. Muscle weakness, bradycardia, nausea, diarrhea, and paresthesia of the hands, feet, tongue, and face are findings associated with hyperkalemia, which is transient and occurs from transient hyperaldosteronism when the adenoma is remote. Fourth question. Nurse Louis is developing a teaching plan for male client diagnosed with diabetes insipidus. The nurse should include information about which hormone lacking in clients with diabetes insipidus. A, antidiuretic hormone. B, thyroid stimulation hormone. C, follicle stimulation hormone. D, luteinizing hormone. Answer is A, antidiuretic hormone. ADH is the hormone clients with diabetes insipidus lack. The clients TSH, FSH, and LH levels won't be affected. 5 questions. For male client with hyperglycemia, which assessment finding best supports a nursing diagnosis of deficient fluid volume? A, cool clammy skin. B, distended neck veins. C, increased urine osmolarity. D, decreased serum sodium level. Answer is C, increased urine osmolarity. In hyperglycemia, urine osmolarity increased as glucose particles move into the urine. The client experienced glucosuria and polyuria, losing body fluids and experiencing fluid volume deficit. 6th question. Acromegaly is most frequently diagnosed in A, middle-aged adults, B, newborns, C, children aged 2 to 5, D, adults aged 65 and older. Answer is A, middle-aged adults. Acromegaly results from tumors on the pituitary gland that produce excessive amounts of growth hormone. Although symptoms may present at any age, the diagnosis generally occurs in middle-aged persons. Graves' disease is the most common cause hypothyroidism. B, the most common cause hyperparathyroidism. C, the most common cause of hyperthyroidism. D, the most common cause of adrenal insufficiency. Answer is C. Graves' disease is an autoimmune disorder characterized by the enlarged thyroid gland and overproduction of thyroid hormones, producing symptoms of hyperparathyroidism, such as rapid heartbeat, heat intolerance, agitation or irritability, weight loss, and trouble sleeping. Eighth question. Symptoms of Graves' ophthalmopathy include all the following except A, bulging eyeballs, B, dry, irritated eyes and puffy eyelids, C, cataracts, D, light sensitivity. Answer is C, cataracts. Graves' ophthalmopathy. Graves' ophthalmopathy is inflammation of tissue behind the eye causing the eyeballs to bulge. In addition to above-mentioned symptoms, Graves' ophthalmopathy may cause pressure of pain in the eyes, double vision, and trouble moving the eyes. Ninth question. An ACTH stimulation test is commonly used to diagnose A, Graves' disease, B, adrenal insufficiency and additions disease, C, cystic fibrosis, D, Hashimoto's disease. Answer is B, adrenal insufficiency and additions disease. The ACTH stimulation test measured by blood and urine cortisol before and after injection of ACTH, person with chronic adrenal insufficiency or additions disease generally do not respond with the expected increase in the cortisol level. 10th question. All of the following are symptoms of Cushing syndrome. Expect A, severe fatigue and weakness, B, hypertension and elevated blood glucose, C, a protruding hump between the shoulders, D, hair loss. Question is D, hair loss. Women who suffer from high levels of cortisol or have irregular menstrual cycles or amenorrhea and present with hair on their face, necks, chests, abdomens, and thighs. Which is the following condition is caused by long-time exposure to high level of cortisol? A, additions disease, B, Crohn's disease, C, adrenal insufficiency, D, Cushing syndrome. Answer is D, Cushing syndrome. Cushing syndrome is from form of hypercortisolism. Risk factors for Cushing syndrome are obesity, diabetes, and hypertension. A speed test or newborn screening may be used to detect A, cystic fibrosis, B, adrenal insufficiency, C, Graves' disease, D, hypothyroidism. Answer is A, cystic fibrosis. Cystic fibrosis is most common inherited fatal disease of children and young adults in United States. Cystic fibrosis is usually diagnosed by the time an affected child is 3 years old. Hashimoto disease is A. Chronic inflammation of thyroid gland. B. Diagnosis most frequently in Asian, American, and Pacific Islanders. C. A rare form hypothyroidism. D. A rare form of hyperthyroidism. Answer is A. Hashimoto's disease is the most common cause of hypothyroidism. It is an autoimmune disease that produces chronic inflammation of the thyroid gland. Persons at increased risk of developing Hashimoto disease include all of the following aspects. A. Persons with vitiligo. B. Asian Americans. C. Persons with rheumatoid arthritis. D. Persons with Addison disease. Answer is B. Along with the above-mentioned group, persons with type 1 diabetes and persons suffering from pernicious amnesia are at increased risk of developing Hashimoto disease because it tends to run in families. There is likely genetic susceptibility as well. Environmental factors such as excessive iodine consumption and selected drugs also have been implicated as potential risk factors. All of the following statements about Hashimoto disease are true aspects. Many patients are entirely asymptomatic. B. Not all patients become hypothyroid. C. Most cases of obesity are attributable to Hashimoto's disease. D. Hypothyroidism may be subclinical. Answer is C. Although weight gain may be a symptom of Hashimoto disease, the majority of obese people have normal thyroid function. Rarely is thyroid disorder the sole cause of obesity. Let's play a code game then. This is our game pin. I'll wait all of you. Let's get started. Nurse Troy is aware that the most appropriate for client with Addison disease. After thyroidectomy, which of the following is the priority assessment to observe laryngeal nerve damage? When caring for a male client with diabetes insipidus, Nurse Juliet expects to administer Nurse Oliver should expect a client with hypothyroidism to report which health concerns. Caring for a prospective parathyroidectomy client, which of the following would require to nurse immediate attention? Which outcome indicates that treatment of male client with diabetes insipidus has been effective? Which of the following assessment findings characterize thyroid storm? Nurse Wayne is aware that positive chat work sign indicates. Which of these signs suggested a male client with a SIDA secretion is experiencing complications? Which instruction about insulin administration should nurse Kate give to a client? Thank you for listening.